Ever feel like you're just swimming in health information, trying to
Yeah.
figure out what's real, what's maybe hype, and what actually matters to you?
Oh, absolutely. It can be overwhelming.
Yeah, we've all been there. So today we're doing a deep dive into exactly how mpox spreads. We want to cut through some of that noise and get straight to the clear, actionable stuff.
Kind of a shortcut to really understanding it.
Exactly. Because many of us have heard about mpox, but maybe haven't quite, connected all the dots on how it actually moves around.
Hmm.
Our mission here is simple: give you a solid, comprehensive understanding of mpox transmission. We're looking at what's known, what's still being researched.
So you grasp the what, the how, and the why.
Right. And we're using the best info we can directly from the CDC, the Centers for Disease Control and Prevention, specifically their guidance updated January 30, 2025.
So reliable, up-to-date information.
Definitely.
Yeah.
So let's unpack this together. By the end, you should feel genuinely well informed. Let's jump right in then. The big picture: how does mpox travel? The CDC basically lays out three main pathways.
At a glance, yeah.
First, and this is probably most relevant for many of us, is close or intimate contact with someone who actually has mpox.
Okay. Human to human.
Second, there's direct contact with an infected animal. Now, that's more common in certain parts of the world, we should say.
Right, where it's endemic.
And third, contact with contaminated objects, things an infected person has touched or used.
Fomites, yeah.
The CDC also mentions two main types, or clades, clade 1 and clade 2. But importantly, they stress that both clades spread in pretty much these same ways.
So the basic routes are similar regardless of the clade.
Yeah. What's kind of striking is how laying it out like this immediately helps clarify things, maybe challenge some initial assumptions we might have.
You've really hit on something vital there. Just knowing these broad categories is, well, it's the foundation. It helps you understand your own risk
Right.
and, crucially, how to protect yourself and, others around you.
Yeah.
It starts to demystify the whole process.
Okay, so foundation set. What's a key detail right off the bat?
I think the length of contagiousness is absolutely critical for you to grasp. Someone can spread mpox from the moment their symptoms start,
Okay, from sim to onset.
all the way until their rash is completely healed. And that means a fresh new layer of skin has formed underneath.
Wow, okay, so that's not just a few days.
No, not at all.
Interesting.
Could be weeks. Which really highlights why awareness and sustained caution are so important.
That extended time frame until the skin is fully healed, that's definitely a detail that seems easy to miss, really shows the persistence.
It does.
So let's zoom in now on that first pathway, the close or intimate contact, because this seems to be where it gets, well, really nuanced, more complex than maybe people think.
It is, and it's the most common way it spreads between people.
Right, and it's not just like brushing past someone on the street.
Definitely not.
We're talking direct skin-to-skin contact, obviously, with the mpox rash itself, or the scabs, that seems clear.
Yes, contact with lesions.
But it's not just the visible rash, is it? The virus can also spread through contact with saliva, those upper respiratory secretions, so yeah, snot, mucus.
Right.
And also, importantly, bodily fluids or lesions like open sores or skin changes, especially around the anus, rectum, or vagina of someone infected.
Precisely. And when the CDC talks about close personal contact, they're really emphasizing the type of interaction. It's those moments where fluids, skin, or mucous membranes are directly involved.
So intimacy is key.
Yes. This definitely includes intimate activities, oral, anal, vaginal sex, touching genitals, or the anus. But, and this is critical, it goes beyond just sexual acts.
Okay, how so?
It extends to other forms of very close physical affection, things like prolonged hugging, massage, or kissing.
Ah, okay. So activities that involve sustained skin contact or potential fluid exchange.
Exactly. These create the necessary conditions for the virus to transfer, especially if there are maybe unseen lesions or viral particles on the skin or in secretions.
Right, because the amount of virus, the viral load on those lesions is super high, isn't it?
Extremely high, making direct contact with them a very efficient way for the virus to spread.
So it's really about the intensity and closeness of the physical contact, not just one specific act.
That's a good way to put it.
And there's another aspect of close contact mentioned: pregnant women. They can pass the virus to the fetus during pregnancy or to the newborn during or after birth.
Yes, that perinatal and postnatal transmission. It's a sobering reminder and highlights why early detection and careful management are so important for pregnant individuals.
It really broadens the definition of close contact in terms of transmission.
Absolutely.
Hmm.
It tells us our understanding of intimate contact needs to be pretty expansive. It's not just about avoiding obvious sores, but recognizing many close interactions could facilitate spread.
Which brings us back to awareness, self-monitoring.
Exactly. Watching for any unusual skin changes, even before you might think it's mpox.
Okay, that covers person to person pretty thoroughly. But what about indirect routes, things that aren't direct physical contact?
Right, because the virus can hang around.
Exactly. The environment becomes a factor. So let's talk about contaminated objects.
Fomites.
Right, fomites. The CDC guidance confirms mpox can spread through contact with things like clothing, bedding, towels.
Utensils, dishes.
Yeah, even fetish gear or sex toys if they haven't been disinfected after someone with mpox used them. Basically, items that touch an infected person's skin or fluids closely.
Precisely. And these fomites, these objects, they play a really crucial role. The virus can survive on surfaces for a while.
How long depends on conditions, I guess.
Yeah, it depends on things like temperature, humidity, the surface type itself. So
Yeah.
if someone with mpox uses a towel, touches the doorknob, sleeps in bedding,
And it's not cleaned.
right? If it's not properly cleaned or disinfected, it creates a potential bridge for the virus to jump to someone else.
So good hygiene, disinfection, especially if someone in the house is sick, becomes really important.
Incredibly important. It helps break that chain of transmission. It's not just what you touch, but what the person who is sick touched before you.
That really brings the everyday environment into the picture. Now, beyond objects, let's talk about animals, the original source.
Where it all began, essentially.
Yeah, this might be less common for many of us daily, but it's critical for understanding mpox globally.
Absolutely.
So the virus spreads from animals to people, particularly small wild animals in West and Central Africa. That's where mpox is endemic, right? It naturally circulates there.
Correct.
And this jump can happen through close contact with an infected animal, its fluids, waste, or getting bitten or scratched.
Mhm.
So things like hunting, trapping, processing infected wild animals in those areas are definite risks.
What's really insightful here is understanding the zoonotic nature of mpox. It's not just a technical term. It means the virus lives naturally in animals and can spill over into people.
So it's not just a human disease problem.
Not at all. It's part of a bigger picture, what we call One Health. It involves ecology, wildlife, human-animal interactions, adds layers of complexity to prediction and prevention.
That One Health idea definitely adds depth. Okay, so it starts with wild animals. But what about pets? Our cats, our dogs?
Well, the CDC is careful here. They say people are less likely to get mpox from a pet.
Okay, less likely, but possible.
But it is possible through very close contact. Petting, cuddling, hugging, kissing, licking, even sharing sleeping areas or food with an infected pet.
So pets can actually get it and potentially pass it on.
Yes, they can contract it, show symptoms, and then potentially transmit it to humans, which leads to a really important prevention tip.
Which is?
If you have mpox, you should actually avoid contact with all animals, including your pets.
Really, to protect them.
Exactly, to prevent spreading the virus to them. It's a temporary measure, but important for their health and, preventing further spread back to humans potentially.
Good to know. Keep a healthy distance from our furry friends if we're sick, for everyone's sake. Okay, now let's shift gears slightly. Let's tackle some common misconceptions.
Always important, what it's not.
Right. Because in this age of, let's face it, rampant misinformation, knowing what isn't a significant risk is just as vital.
Couldn't agree more.
Let's start with airborne transmission. This causes a lot of anxiety with viruses.
Understandably so.
The CDC is pretty explicit here. Mpox is not known to spread through the air over long distances in typical settings. Think across rooms, in markets, classrooms.
Okay, so not like measles or COVID-19.
Exactly. Now, they are careful with the language. They acknowledge studies show the virus can be found in respiratory droplets, and lab animals can transmit it very close up over long periods. But crucially, real-life outbreaks show human-to-human respiratory spread seems low.
And usually requires that prolonged face-to-face contact.
Right. It's a very different picture than truly airborne viruses that just hang in the air.
That distinction is incredibly important. Droplets versus aerosols. Droplets are heavier, fall quickly, need close proximity. Aerosols are finer, hang around, travel further.
And mpox seems to be mainly droplets.
Mpox transmission, even if respiratory secretions are involved, seems to rely on those heavier droplets, needing that sustained close contact.
Which explains the specific recommendations.
Exactly. Infected people wearing masks around others, caregivers using PPE. It's not because it's floating freely through the air everywhere, but to reduce droplet exposure during those necessary close interactions.
Targeted precautions, not widespread panic. Makes sense.
It clarifies the difference between a theoretical possibility in a lab and what we actually see happening in the real world.
Okay, good clarification. What about water? Pools, hot tubs, splash pads? Any worries there?
Good news on that front. The CDC says no studies have found a clear link between mpox and recreational water like that.
None at all.
And in fact, the virus is killed by the recommended chlorine levels used in pools and hot tubs.
Oh, okay, so standard disinfection works.
It does. So you can put those specific worries aside.
That's reassuring.
Yeah, it's a great example of science providing clarity. Knowing standard water treatment works lets us focus prevention efforts where they're actually needed.
Right, focus on the real risks.
And it reminds us pathogens behave differently.
Yeah.
You need specific guidance for each one. Encourages critical thinking, really.
Absolutely, helps prioritize. Okay, let's talk timing. This seems really key. When exactly is someone contagious?
Crucial piece of information.
The CDC is specific. A person can spread mpox from the moment symptoms start,
Okay, symptom onset.
all the way until that rash is fully healed and a fresh layer of skin has formed. That's the main window.
Right. Weeks, potentially.
But here's a complication, right? Sometimes people can spread it before symptoms appear.
Yes, that's the pre-symptomatic phase. 1 to 4 days before they even develop symptoms.
Wow. So you could be infectious and not even know it yet.
Exactly. And that's a real challenge for public health and for individuals. By the time someone is clearly sick and gets identified, they might have already unknowingly spread it.
Underscores the need for awareness if you've been exposed.
Definitely. Heightened awareness, maybe limiting close contact if you feel unwell even before a rash, especially after a known exposure.
Okay. And what about people who get infected but never show symptoms? Asymptomatic spread.
That's the million-dollar question often. Currently, the CDC states there's no evidence that people who never develop symptoms can spread mpox to others.
Okay. So different from pre-symptomatic.
A critical distinction.
Yeah.
However, and this is where science is always ongoing, they are actively monitoring this.
Because finding asymptomatic spread is hard.
Extremely hard. You're trying to track transmission from someone who doesn't even know they're sick. It requires really sophisticated studies.
Like finding a ghost in the machine, you said earlier.
Pretty much, yeah.
Speaking of monitoring and ongoing science, it's good the CDC is transparent about what we don't know yet, right?
Absolutely. It shows a commitment to the process.
They list some areas of active research, like exactly how often someone with no symptoms could spread it, even if current evidence says it's unlikely.
Right. Quantifying that potential risk.
And also clarifying precisely how it spreads through respiratory secretions, the exact mechanisms the conditions needed.
Understanding the fine details of that route.
And crucially, research is still ongoing to determine definitively if mpox can spread through semen, vaginal fluids, urine, or feces.
Yeah, this is a key point. They might find virus genetic material in those fluids.
But that doesn't automatically mean it's infectious that way.
Exactly. Proving it's actually infectious and a significant transmission route requires complex studies. Detecting virus isn't the same as proving transmission. Those studies are still underway.
So these still learning points aren't weaknesses, but just science in action.
Precisely. It's a transparent commitment to finding answers and adapting public health advice as we learn more. For you, the listener, it just means staying tuned to reliable sources like the CDC is crucial. Understanding evolves.
It's an ongoing dialogue between the virus and the scientists.
Well said.
Okay, so that brings us towards the end of this deep dive on how mpox spreads. We've covered a lot of ground.
We have.
We looked at the core pathways, that close, intimate human contact, contaminated objects, and the animal origins. We also cleared up some myths, clarifying it's not typically spreading through the air over desances or in treated water.
Important distinctions.
And we dug into the timing that critical contagious period, including the tricky pre-symptomatic phase, and acknowledged the areas where science is still actively searching for answers.
Yeah, the knowns and the unknowns.
So hopefully you now have a much clearer, more nuanced, evidence-based picture of mpox transmission straight from the experts at the CDC. Thanks so much for joining us for this.
Given everything we've explored today, the specific ways mpox spreads, how that understanding evolves from animal origins to human contact, the nuances, the areas still under investigation. What does this tell you about the importance of critically evaluating health information and maybe adapting our own behaviors and public health strategies as new scientific insights emerge, especially when we face these big global health challenges? It really is a journey, isn't it? Not a fixed destination.